Is that high enough?
James Broach, along with his wife Jamie and their 3 young sons, present a picture-perfect life, active and full of fun.
I've been married for 8 years now to a wonderful woman, and we have 3 wonderful kids, Parker, Harrison, and Oliver, so we've been pretty busy. Family's been important to me.
It's the kind of life the couple has worked for.
I went to Trinity University in San Antonio, Texas, as did my wife. After Trinity, I worked for a small investment bank and went to business school at the same time my wife went to law school.
For his 12-year career, James has worked in the energy business as an investment banker and a venture capitalist. It's a picture of success, with not the slightest hint that a year and a half ago, his life took a radical turn.
I had symptoms that I thought may have been related to early signs of MS, and so I met with a neurologist who did an MRI, and I found out I didn't have MS, but I found out, I likely have a brain tumor.
James sought help at the University of Texas MD Anderson Cancer Center, where it was confirmed that he had a stage 2 brain tumor. Surgery revealed the tumor had advanced to a stage 4 glioblastoma, the most deadly form of brain cancer.
Every appointment that we have with Dr. Lang, we would always ask, what are you working on, what are you researching, what's coming down the pipe, what trials are going on. And the more we heard from Dr. Lang about his research, the more excited we got about it.
Dr. Frederick Lang, Director of Clinical Research in the Department of Neurosurgery at MD Anderson, is trying to find a cure for glioblastoma. The average survival after diagnosis is only 9 to 18 months, and it's been that way for 50 years. James decided he wanted to change those statistics and to help others who were facing the same diagnosis.
After my surgery, several nights in a row, I was just lying awake and really wanted to come up with something that could make a difference at MD Anderson or here in Houston or in Texas.
In November of 2011, James and Jamie created the Broach Foundation for Brain Cancer Research with the goal of raising money for a cancer that is much underfunded. They put together a first-class board of directors that has been passionate about making the fundraising process a success. The inaugural grant will go to support Dr. Lang's research.
Research drives the whole process, and without research, we're not going to make an impact on tumors.
Dr. Lang studies the effects of an adenovirus called Delta 24, which was engineered at MD Anderson by Dr. Juan Fueyo to specifically affect brain tumors. Dr. Lang surgically injects the virus into patients through the skull, straight into the brain tumor.
We proved in patients that the virus infects the tumor cells, replicates and grows in the tumor cells, kills the tumor cells, and then goes on and infects more tumor cells. And that biological information in a patient proved to us that this can work.
Dr. Lang is now looking for better ways of delivering the virus that would eliminate the patient having to go through surgery.
My hope would be that in the next 10 years, we can at least turn these very aggressive grade 4 tumors into what we might consider a chronic disease, where people have the tumor, but they're living with it without it continually growing.
James Broach has been living with glioblastoma, and having a serious illness has put a lot of things into perspective.
I have kids that look up to me and a wife who needs me to be there and be present. To be honest, I don't think about the brain cancer. I don't feel like I have brain cancer. I'm not in denial. I just don't focus on it. I think the strength comes from not having a choice.
But James does have a choice about what he cares about, his family, his friends, and the Broach Foundation, which has quickly become one of the largest Texas-based charities supporting adult brain cancer research.
Our goal is to get to $1 million for 2012 and then figure out how to have a bigger and better event next year. We feel like by working with the premier cancer hospital in the country that we can make a big difference over the next decade.
Research is the lifeblood of MD Anderson's mission to eradicate cancer. The work of Dr. Lang and others in brain cancer is enabling us to develop key therapeutic and diagnostic advances in this very dreaded disease. So the support of the Broach Foundation is enabling these brilliant investigators to move forward in this very important area. And this type of support is vital for us to make progress.
All the doctors we've ever talked to have been so excited about the research going on, and they really feel like we're just a few years away. You know, within 5 to 10 years we could see a cure for brain cancer. So we just want to help, impact that and make a difference.
I hope that people consider making a donation, not just for me, but for underfunded cancers in general, because there are a lot of them, and I think we can make a big difference in the next 5 to 10 years.